Charting of the teeth is again very important whenever we are conducting an investigation and we want to maintain the personal identity of the suspect, or we want to maintain the personal identity of the victim. It's again very important to chart the teeth of the person to get the correct and the accurate information in a more scientific method. So this charting is not usually done through the method. It can be done through the photographs, and even the photographs, if they're taken, they have to be charted in a particular scientific method. So in this section, we are dealing with this charting phenomena, which is quite handy. The diagrammatic or anatomical charts are usually looked for. There are a lot of methods that have been devised, and we're going to study them over here. The features and the comparison with the antemortem records is again very important, but this comparison can only be made if we have the previous records or if we have the previous history of the patient in detail. The pink teeth is a very interesting phenomena that is usually seen post-mortemly. And why does it occur? What is this phenomena? What is the basic pathophysiology between this behind this phenomena? It will be discussed in this section. So charting of the teeth, as we were already discussing, it's very important and it's very crucial. No internationally accepted system has been devised for this charting phenomena. The charts used for the future references in identification. Careful record has to be made according to the number or the position of the teeth, and the state of teeth are also recorded down. The methods for the recording data, there are two main methods that have been devised. Describe the position of the teeth, the variation in the sequence of the enumeration, and the first method is usually the diagrammatic charting phenomena. So it is used in the large dental services areas. And then we have the second method, which is more pictorial teeth representation, or we usually take a picture of the dentition, which will give you an idea about the dentition of the person. So the features recorded in the exact topography, they're again very important. So this is usually the way by which the charting is usually done. We have the teeth, but this is basically not showing you the lateral and the posterior surfaces of the teeth. So usually the scientific methods in which there is a proper charting phenomena seen, we have the lateral views and we have the posterior views as well. So the forensic odontologist or the forensic pathologist is basically commenting upon the four sides of the teeth along with it, anteriorly, posteriorly, and two laterally. They are very important in the transportation fatalities. For example, in the air crashes or in the train injuries, such as the air crashes, and the diagrammatic or the anatomical charting is again very important. Each teeth will have a pictorial symbol, and this pictorial symbol is going to basically give you an idea about the base of the teeth, and that it is going to give you an idea about the lateral surfaces, the anterior surfaces, and the posterior surfaces. So the whole of the teeth should be recorded, and the incisors and the canines usually have the four surfaces. Premolars and molars, they have the occlusal surfaces, and the fillings, crowns are usually deleted in such a pictorial diagram or the diagrammatic representation of the teeth. The gaining access to the mouth is again very important, and this is due to the process of the rigor mortis that has set in after the death. Access to the mouth is the requirement over here. The rigor mortis makes it difficult for the mouth to get open. In such a case, there is no use of excessive force, because if the force is applied, we can usually damage the dentition, and that is what we don't want to do in a case of personal identification. We have to have the complete knowledge about the dentition, and we lose that information if we apply forces in this particular case. So otherwise, they're going to damage the teeth. The Topsy incision is usually a V-necked incision. The dissection skin is basically taken off from the lower part of the face, and then we gain access to the masseter and the temporalis muscle. Precautions are taken not to cosmetically disfigure the face of the deceased person. The decomposing body, usually it doesn't have a rigor, and the body which is badly rotted, the cosmetic considerations do not apply over here. The more radical removal of the jaw can be done in such a case, and same can be performed for the badly burnt bodies. Then in burnt bodies, the heat contractions of the facial muscles and the dissection of the tissues has to be carried out in such a case, because we have to exclude any suspect, or if you're suspecting a case of poisoning, we have to have the dissection of the tissues, and we have to send these to the histopathologist for further detailing phenomena. The removal of the mandible and the maxilla is again very critical in cases of the burnt bodies. The preservation is done by the sawing the maxilla horizontally. So it's the preservation. How is it done? At lower margins of the nasal aperture, this sawing phenomena is carried out, and the complete photography of the mandible as well as the maxilla is done, and then there is a complete and detailed charting phenomena that is performed for a particular case. Preservation is done in the freezers, and the soft tissue is cleaned, and the dry bones basically give you a better idea. The DNA identification techniques are also used in this particular case. The radiography of the head is done. The record basically gives you a presence of the dental prosthesis. A dentulous person basically gives you an idea. He's an aged person. He will show a worn out denture. The pressure marks on the gums are again very important, and we'll perform the radiographs or the CT scans of the head. Craniometry or the frontal sinus visualization is done, and it may show unexpected foreign bodies. Broken drill, broken roots are found in this phenomena, and they may show the congenital abnormality cases. Antemortem records are also very important for the comparative studies in such a case. The features that have to be recorded in this particular case, they are the extractions, whether recent or old. They have to be documented. Fillings, they can be in number, they can be in position, and they can be in composition. Artificial teeth and what kind of material was used for the teeth, whether it was porcelain or whether it was gold. Other prosthetic work, for example, the bridge work or the braces, has its own significance, and if we have any features of the crown teeth. Now, all of these features, if we have any ante-mortem documentation or ante-mortem record of the person, then it's very easy to basically compare all of these features with the ante-mortem records. That will give you a clearer picture of the consequence. Now, the broken teeth and the pathological conditions in the teeth, jaw, and gums. The congenital defects, the carabelli cusps, the extra cusps, the enamel purling phenomena, they have to be looked for. Then we can look for the malpositioned teeth as well. Rotated or twisting phenomena if it is seen in the gums. Then we can have the general state of the care and the hygiene. So the general case of neglect or the general hygiene or oral hygiene is looked for in this particular case. And then we can have the racial pointers that are going to point out to which racial belonging this particular person is from. It can be a shovel-shaped or a multi-cusped molars in this particular case. So that will basically give you an idea about the racism. Depends upon the quality and the date of the records, and records are more exact in the autopsy charting. Features in the actual jaw, and they are sometimes not present in the chart. So this is again very important. We have to have the comparison for the ante-mortem records, and sometimes these features are excluded in the ante-mortem records or they're not recorded on the autopsy. Both can be the case. The consideration of the non-dental aspects is again taken, and we have to evaluate the forensic from the forensic odontologist, or we have to have the expert views of the people around us. Now, there is a very interesting phenomena usually seen in the postmortems. We have the pinkish discoloration of the teeth. Now, why does this phenomena occur? It's due to the autopsy on the putrefied bodies. So this phenomena is usually seen in the putrefied bodies. There is a marked pinkish discoloration in the teeth, especially near the gum line, as shown in these pictures. The dentine staining is done by the hemoglobin products that usually accumulate at the gum level. So after this accumulation of the hemoglobin at the gum level, this pinkish discoloration is given to the teeth. The congestive mode of death is sometimes advocated upon the cause of the pinkness of the teeth and due to the retention of the blood in the pulp. So in this section, basically, we dealt with how are we going to chart the dentition when we have conducted an autopsy, and we're going to analyze the personal identification in this particular case. So that is the end to this section. Thank you for watching sqadia.com.